You're listening to Health Professional Radio. Welcome. Glad that you could return for another segment. I'm your host, Neil Howard. We're going to have a conversation with returning guest Bill Rancic. He's joining us to talk about his ongoing partnership with the Astellas Oncology's C3 or Changing Cancer Care Prize program. Welcome back, Bill. Thanks for returning.
Thanks, Neil. Really appreciate having me back on.
Give our listeners who may not be familiar with you, you've been here with us before talking about the C3 Prize. Give us a little bit of your background. Talk about your role as a caregiver and talk about this C3. Well, as a matter of fact, this fifth annual C3 Prize.
That's right. That's exactly right. It's the fifth annual C3 Prize. And, for me, I've been an entrepreneur my whole life. Also work in television. I've written books, and my wife, Juliana Rancic, is a television host, and recently she's become an entrepreneur as well. And years ago, my wife was diagnosed with breast cancer, and this was something that obviously was rather shocking to us. She was, in her mid-30s, in perfect health, and out of nowhere, she was hit with breast cancer, and it was something that really kind of gave us a wake-up call. And several years ago, 3 years ago, I was approached by the folks at Astellas Oncology, and they had this amazing program that they were doing called the C3 Prize. Like you said, it stands for Changing Cancer Care. And when they told me a little bit about it, I knew in a matter of 5 seconds that this is something that me and my wife, Juliana, wanted to be a part of. And essentially what the C3 Prize is it's a program that Astellas Oncology had launched to really help improve the cancer care for patients, caregivers, and their loved ones. And what we're doing this year is we're awarding up to $200,000 in grants and resources to help advance ideas that make a big impact in the cancer care community. So, one of the things that I've been doing is I've been, screaming from the mountaintops, letting people know, if you have an idea, we want to hear from you. If you have something that is beyond medicine, we want to hear from you. And we want to take these ideas and help move them forward, because so many of the ideas that we've seen in the past have had such a tremendous impact on not only the folks who are going through cancer care, but as I said, the caregivers and everyone that is surrounding them, because it takes a village when you're going through this. So something that I'm very proud of. And again, I think I want to be a part of it for many, many, many years, because it's really phenomenal for me to see all the brilliant ideas out there. As an entrepreneur myself, I see so many people just really dedicating their lives to this, important cause.
A lot of folks, when you say the word cancer equals doctors equals medicine. Okay. Now, you mentioned beyond medicine. What types of ideas are we talking about, and who can apply?
Well, anyone can apply. With any idea that you think will have an impact on people who are going through cancer. And I think if I give you an example of who won last year, because we spoke about a year ago, maybe a little more, but last year the winner was a wonderful woman named Audrey, and she had created an organization called the Nanny Angel Network. Now, she was a cancer survivor. She'd gone through some of the challenges that journey provides people who are going through it. And she realized that there was a real need for childcare. But not only, childcare, but providing the right kind of childcare, because the kids are going through this cancer journey with their mom, right? So she created this organization that really provides free childcare to the folks who are going through this, but training them, right? Training them with how to handle this cancer journey that their mom is going through, or their loved one's going through, and really helping ease the burden of those kids who are watching their mom go through breast cancer, and I thought that was really spectacular, because it was beyond medicine. But a lot of us don't realize that there's so many layers to cancer, and there's so many areas that need to be addressed when trying to ease the burden.
Now, these don't have to be big, elaborate ideas. They can be something that get an inspiration in the shopping center, or you're watching television, or you may be, taking care of someone who's dealing with cancer, and a new challenge presents itself, and you say, hey, if only A, B, or C. We're talking any type of idea. No idea is too small, right?
No idea is too small. And this year, like I said, we spoke a year ago, and before we came on, we said, wow, what a difference a year makes. And this year we're really trying to shift the focus a little bit. to help address some of the world's most pressing problems, right? Like COVID-19
Absolutely.
and the health disparities that this is creating in the cancer community. So, I want to say that the beautiful thing about this is that we get to, provide them with this grant, but we also provide them additional resources to help them and help them be prepared for success. And the wonderful thing about Astellas is they will maintain no ownership in these ventures that are funded by the C3 Prize. So this is really, you're seeing an example of corporate America really doing this to advance this, taking no ownership, no financial stake in these ideas. It's strictly to help change the lives of those people who are going through this.
Now, is there anything that applicant needs to have any type of professional experience in? Is that a requirement or not at all?
Absolutely not. I think if they can, have a computer and get online and go to c3prize.com, that's probably the most important thing. And the wonderful thing is we designed this because we realize people are very busy, right? And there's a lot going on. So we don't want them to come on and write a dissertation. It's a very simple application process. They can go to c3prize.com now through September 28th, 2020. That's when this is going to end. So they've got a little bit more than a month to submit their ideas. And we're really open to any idea that can have an impact. Even if it's a simple idea, that's okay.
Now, for those who are following the C3 Prize, when will the finalists be announced? Do you know that yet?
Well, we're gonna go through the process. We're gonna get all the applications, and then let me tell you, as a judge, it is not easy because there are so many brilliant ideas out there. Like, probably the hardest thing that I have to do is being a judge because it's so hard to narrow this down because there's so many great ideas, so many people who really want to get their ideas taken to the next level and help advance this. So we're going to work it down. We've got one of the past winners who is a judge again this year. And we've got some absolutely spectacular judges. But September 28th is the cutoff. And then December 20th, the finalists will be announced, December 20th of 2020. And then the actual winner will be announced March of 2021.
Talk to those who submitted ideas in the past and their idea was not necessarily picked.
We like to think that everyone is a winner because they get, we try to give them exposure. We have different levels of grants that we'll be issuing. And we also provide mentoring to some of the people. So, for example, this year, they're going to get a year-long complimentary membership to Matter, which is a global healthcare startup incubator, right? So all winners are going to be provided access to these tools and resources. So, we give them grant money, we give them some mentoring, and certainly we're going to give them a lot of exposure because, that's one thing that I think is very important to help let the world know what brilliant ideas are out there and what these people are doing. And
past applicants, can they reapply?
They can reapply. Absolutely. You can reapply. We encourage it. We want to hear from as many people as we possibly can. And this is something that is important to everyone on the team. And really, all the folks at Astellas Oncology have been absolutely spectacular to work with. Day in, day out, we're so involved in this, and it's been so impressive to see just how passionate everyone has been that's been a part of the C3 Prize. It's been wonderful, absolutely wonderful.
Appreciate you coming back again. The 5th annual C3 Prize. Once again, that website where people can learn more and apply for this 5th annual prize.
c3prize.com. And please, don't put it off because a lot of people think, I'll do it tomorrow. Do it today. Get it off the to-do list. And I promise you, it's a very simple application. It won't take you long at all. So, we really encourage anyone out there that has an idea that can, help change the world. We want to hear from you.
Bill, thank you so much for returning. We appreciate it. Always a pleasure.
It has been my pleasure. Thank you again for having me on.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Bill Rancic, talking about the 2020 Astellas Oncology C3 Prize. It's a call for entries. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. All right. As I said, these will get edited this week. Is there anything that anybody would like to add, or any suggestions, any notes for us?